Welcome, everyone. We're so excited for the presentation today. We're going to get going here in a few minutes as we let people join the Zoom room. So if you give us some time, we're going to let everybody kind of filter in here. But in the meantime, if you could go ahead and introduce yourself via the chat, let us know your name, the name of your business, and where you're Zooming in from. And if you would like your favorite Thanksgiving food, because it's right around the corner. And so we'll begin in a moment or two here. It's just folks are starting to join. But welcome. Great. I see a few people starting to introduce themselves via the chat. And so we're going to let folks do that. And we're going to get going. But before we start, just a quick kind of Q&A housekeeping slide. We will have time for questions at the end. I know folks may have a lot of questions about Medicare and what it means for your business and your employees. So go ahead and submit your questions via the Q&A button and not via the chat. That helps us track them. And if you want to ask your question live, you can raise your hand and we'll be allowing you to do that as well. And just let you know, this session is being recorded, so we can share that afterwards. So you have access to that in our follow-up materials. And so with that, it's my pleasure and honor to kind of transition the program over to Tricia San Diego from AARP, who'll be presenting on Medicare and what it means for your business. Tricia, over to you.
Great, thank you. Thanks, Colin, and thanks to everyone for joining the session today on Medicare 101, what you need to know for your business and for your employees. My name is Tricia San Diego. I'm a senior advisor with AARP's caregiving and health team. I have a public health background by trade. I'm a certified health education specialist. I do quite a lot of education around caregiving and Medicare. And I think Medicare in particular is very timely right now because we hear a lot of different sort of ads going on during Medicare's open enrollment season, and just sort of health coverage in general is such an important topic. And I think it's important for us to provide the basics because it's really hard to understand all the complexities of Medicare when you don't have the sort of 101 basic knowledge. So good for you all for joining us and signing up today. And I'm happy to answer any questions along the way. Make sure to put them in the Q&A section of the Zoom. So we'll be taking a look at that later at the end of the session. Next slide. So what we're going to cover, as I mentioned, we're going to talk about Medicare basics, that 101 foundational knowledge about Medicare that's really important to get a firm grasp on before you really try to understand all the other sort of complexities about Medicare, because it can get very complex very quickly. We're going to talk about how you can educate your employees on Medicare. Medicare might be something that's relevant for you right now as a business owner or as an employer, but we also want to really encourage you all to help your employees who may be approaching Medicare eligibility, help them navigate it. It's not something that you're required to do, but it's the right thing to do. It's something that can help them in terms of making the most informed decision about their healthcare coverage. And then lastly, we'll point you to some resources and tools that you can use yourself or that you can point employees to that'll be really helpful in order to get some unbiased, credible information that's trustworthy about Medicare. Next slide. Some common questions. I'm not sure if these are questions that you have heard that any of your employees have approached you about. Are these questions that you refer out to other people like brokers or vendors that you may have working in your sort of benefits and enrollment space? Are these questions that you have yourself? Just basic things like, what is Medicare? What does Medicare cover? When should I enroll in Medicare? And what happens if I don't enroll? What are the repercussions of that? How does Medicare work with existing healthcare? Many people do have healthcare coverage through their jobs, through their employers, their employer-based services. And they want to know how Medicare coordinates with that. And that's a really good question, very common, and we'll hopefully address that today. Next slide. So your role as a business owner, first and foremost, is to provide Medicare eligible employees with educational materials about Medicare. It's simply distribute information or point them to a resource. This is something that, again, like I said, not required for you to do, but could be the right thing to do to help employees avoid those penalties, which you'll see is sort of the last thing I have here, and avoid gaps in coverage. We want to connect them with unbiased sources of information. Right now, oftentimes people can be bombarded by different types of ads about Medicare, and it's really hard sometimes to distinguish what's fraudulent, what's a scam versus what's actually real, or what's just marketing. And so, you know, a lot of employees turn to their employers for that credible source of information. And you may not necessarily be the one to be able to answer their direct questions. In fact, you probably shouldn't always be the one to give the exact guidance or advice on what to enroll in and their individual situation, but we certainly want you to be able to point people in the right direction and at least know the basics. And as I mentioned, we want you to be able to help your employees avoid enrollment penalties and avoid those gaps in coverage. Next slide. So first and foremost, what is Medicare? Medicare is actually a bit of an alphabet soup, and we'll quickly learn how that becomes so. There's all these different parts of Medicare that we'll go through, but overall, next slide, it's a federal insurance program that covers people who are age 65 and up. It's also available for people under age 65 with certain disabilities, and it's also for people at any age with end-stage renal disease. So it's not just for the 65 plus, but there's some other unique situations where Medicare does provide coverage. Next slide. So here's some basic terminology, not just about Medicare, but about health insurance that can surprisingly, not surprisingly, get confusing very fast because they're all different things that an employee is responsible for paying, or yourself for your own healthcare coverage. And these are health insurance terminology that also applies for Medicare. So things like monthly premium. Your monthly premium is the amount that you'd have to pay every month to actually have the Medicare coverage. It's the monthly amount an individual would pay to Medicare or a private insurance plan for the healthcare and prescription drug coverage. The deductible is the amount an individual would owe for healthcare services that the health plan covers before your health plan begins to pay. So the deductible may not apply to all services. Sometimes things like preventive services are not included in deductibles, but it's a certain amount, a certain threshold that someone needs to spend and reach before your insurance sort of kicks in. Coinsurance is the amount an individual may be required to pay as a share of the cost for services after they pay any deductibles. Coinsurance is usually a percentage. You'll see things like 80% or 20%, 80% covered by insurance, and your responsibility would be 20%. That's a common breakdown, but that's something you would need to look at in your insurance terms and conditions. Your copayment is the fixed amount an individual would pay for a covered healthcare service, usually when they receive the service. The amount can vary by the type of covered healthcare services. So all of these, many people may already be familiar with because of using your current healthcare coverage, but many of these still apply once you transition over to Medicare. Next slide. So a lot of times people ask, what does Medicare cover? In many ways, it's almost easier to answer what Medicare does not cover. These are very common things that we're asked about, whether or not Medicare covers them. And in general, we're speaking in general, Medicare does not cover things like vision coverage, like eyeglasses and contact lenses. It won't cover dental care unless it's something that's sort of a medical procedure. They're very unique situations where dental care, that needs to happen in a hospitalization, for example, that may be covered, but general preventive care maintenance is not covered under Medicare. Hearing, things like hearing aids and tests are generally not covered through Medicare. And then long-term care. Long-term care services are usually covered through Medicaid instead of Medicare, and that's a common misconception that things like nursing home facility costs and rehab, like that kind of stuff, will all be covered by Medicare, and that's not necessarily the case. There might be some exceptions, so we'll talk through that. For example, you might have a specific Medicare Advantage plan. If you decide to get Medicare through that route, some Medicare Advantage plans are covering these extra type of benefits like vision, like dental, like hearing. And if that's something that's important to you, then that's something we encourage people to look for when they're choosing how they get their Medicare and when they're shopping around for plans. So there are some exceptions, but generally Medicare does not cover these benefits. As I mentioned, the long-term care thing in specific, Medicare does not cover long-term care services, and that is a surprise to a lot of people. Medicare does cover certain services if they're medically necessary, but it's not going to cover things like custodial care, which are going to be things that help people for activities of daily living, such as bathing, eating, dressing, using the toilet, just things that you would need help with just to kind of manage through your day. Those are generally not covered, and that's what we mean when we say long-term care in this situation. Next slide. So the different parts of Medicare. I talked about Medicare being a bit of an alphabet soup, and those who may not be familiar with it may have at least heard the different parts of Medicare. And so we'll break that down in this next section. Next slide. So first, Part A. Part A is your hospital insurance. Part A will cover things like your inpatient hospital care. It will cover some hospice and home health care, and it will cover some skilled nursing facility care. Next slide. Part A, the costs associated with Part A, I have the cost for 2021 listed here. There's typically no premium for Part A. Most people who qualify for Medicare don't actually pay a premium for Part A because you already sort of paid for it through payroll taxes while you're working. It's something like if you've worked 40 quarters in a calendar year, 40 quarters through your employment, then you're able to qualify for this premium-free Part A hospital coverage. If you do not have premium-free Part A, you may be able to buy it under certain conditions. Deductibles for 2021 for Part A is $1,484 for the first 60 days of inpatient care. And then after that, the deductible can be applied again for any additional hospitalizations after 60 days. So in general, I would say if we're trying to just learn about the 101 of Medicare, just know that Part A is hospital coverage. Things like co-insurance, deductibles will apply. And typically you don't have to pay for a premium for Part A if you or your spouse sort of already qualified for that by working a certain number of quarters. And the Social Security Administration would be the agency that you would check with to determine if you're eligible or not, and they're the ones who are sort of calculating that. The things with the deductibles and hospitalizations, that can get confusing really fast, and that's something that you would learn a little bit further on as you get your Medicare coverage. Next slide. Part B. Part B is medical insurance. That's going to cover your doctor visits, your outpatient hospital services, things like durable medical equipment, as well as Medicare-approved preventive services. It's also going to cover diagnostic stuff like laboratory tests, x-rays. It will cover behavioral services like mental health services and benefits. Other things like rehabilitation therapy. Those are all covered under Part B, which is medical insurance. Next slide, we'll go and talk about the costs for Part B. These are the costs for 2021. In general, every year, the premium for Medicare Part B does in fact increase, and it will increase again for 2022. Those numbers were just released, but the current slide that I have right now is for costs for 2021. The standard premium for 2021, this is a monthly cost, is $148.50 for those enrolling in 2021. And then the premiums do go up, however, based on your income. These are called, I think, income related adjustments based on how much you earn. So if you earn more than $87,000 as an individual, then your Medicare premium will go up. And there's sort of a tier-based fee schedule where you look and you can see which tier your income falls in and whether or not you are needing to pay a higher premium as a result of your income. The annual deductible is $203 per year, and this is in 2021, and the coinsurance in general is about 20% for most services. The coinsurance is what your responsibility is or your employee's responsibility is versus what the insurance covers. Next slide. So we're going to talk about Part C next, which is a little bit different in that Part C isn't really a part to Medicare. It's actually a whole other way to get your Medicare coverage. There's sort of two paths to get your Medicare. You can get it through original Medicare is what we call, and that includes Parts A and B, and then generally you'll add a prescription drug program to that. And that's one option, one pathway for getting Medicare is original Medicare. The other pathway to get Medicare is this Part C way, which is a Medicare Advantage. I know it's a little bit confusing that it's called Part C when it's not really a part, but it's sort of its own path for getting Medicare. But Part C is one way, it's an alternative to original Medicare, and it's called Medicare Advantage. It's kind of like an HMO-based insurance coverage where you would buy Medicare plan through a private insurer, and it's an alternative to original Medicare, and all the Medicare Advantage plans must include Parts A and B. So it must include the hospital insurance and the medical coverage that original Medicare Parts A and B cover. In most situations, it includes Part D, which we'll talk about in a little bit, and Part D is prescription drug plans. So one advantage to Medicare Advantage plans is that it's sort of this one-stop shop. If you like the convenience of having sort of everything under one plan, then Medicare Advantage might be something that you look at. But note that there are some trade-offs. It could limit your ability to purchase Medigap in the future. Medigap is a supplemental plan that you would purchase if you want, if you have original Medicare. If you have Medicare Advantage, you may not be able to get a Medigap plan past your initial enrollment time. There's some other trade-offs to consider. Next slide. Things like service area. Medicare Advantage plans will kind of be based on your geographic location, and sometimes you might not be able to access, as wide a network of providers as you'd like. There's normally a contracted, limited network of providers that you have to see in order to keep costs down when you're with a Medicare Advantage plan. So here you may be limited in your choice of providers. If you have an existing doctor that you like to see and they're not part of that Advantage plan, then you won't get that coverage. And so there are some trade-offs in that sense. Like I said, it's limited to the plan service area. So think about things like how often do you travel with this type of option for getting your Medicare work for you. Sometimes you have to pay an additional premium. I referenced earlier that there's some extras, things like vision, dental, hearing. I'm seeing things like transportation services or nutrition counseling or meal services. Newer things are being added to Medicare Advantage plans more and more, and we're seeing that. And sometimes that comes at a little bit of a cost, and you may have to pay an additional premium. But again, it's that sort of convenience of all-in-one plan and that bundling of services. And then you have to follow insurance company rules in terms of you may have to require a referral to see a specialist, or they may have other things that they require before you sort of go out and obtain services. So before choosing Medicare Advantage as your path to getting your Medicare, that's an alternative to original Medicare, make sure you have a kind of a grasp of how Medicare Advantage plans work before you join. Next slide. So we kind of took a sidestep and talked a little bit about Part C, but now we're going to go back to Part D, which is drug coverage. And Part D is easy to remember because I always think about D, drug coverage. And Part D is something that you would purchase if you go with original Medicare and you have your Part A and your Part B sort of a la carte, and then you're adding your Part D as a separate prescription drug coverage plan. Prescription drug coverage plans help cover the costs of prescription drugs that you would pick up, let's say at the pharmacy. This is run by Medicare approved private insurance companies. So Part D is something that you have choice and selection in. You have to sort of shop around when you're enrolling in Medicare Part D plans. And it's really important to kind of assess what prescription drugs you take and match that with the coverage that the different plans offer in Part D. And then you would enroll in that Part D plan, that prescription drug coverage plan. And again, you have that ability to compare across multiple types of Part D plans, but it's something that you do have to purchase in addition to in order to have prescription drug coverage if you go the original Medicare route, which is going to be A, B, and D. And that's prescription drug coverage. You must join a plan run by an insurance company approved by Medicare. That's what we call creditable coverage. And it's important to sort of have this creditable coverage for Part D plans, because if you don't have the sort of right kind of plan that's like approved by Medicare, then you could face penalties if you don't enroll in a Part D plan and if you don't enroll on time. So just something to consider. Going over the costs, next slide for Part D. The costs for 2021, again, these numbers likely are going up in 2022, but for 2021, people enrolled in Part D have to pay your monthly premiums, you'll have to pay co-payments, co-insurance, and there's usually an annual deductible of up to $445 in 2021. Some Part D plans may not have a deductible, but we know that they can't be any higher than $445 for 2021. Just like with Part B, Part D premiums are based on your income. And so people with higher incomes that sort of meet certain thresholds, I believe in 2021, it's $87,000 for an individual or $174,000 if you're a couple. That will impact your monthly premium for your Part D plan. So yet again, another sort of income related adjustment that would need to be made for your Part D. Next slide. This is sort of a good summary of how I describe the two pathways that someone can get their Medicare. Original Medicare, I like to kind of think of as a la carte, and that's going to have parts A, B, and D kind of all separate. But you're all putting that under the umbrella of original Medicare. You will have your hospital insurance covered through Part A, your medical coverage through Part B, and then prescription drug coverage is going to be through Part D. Oftentimes with original Medicare, people purchase what we call a Medicare supplemental plan. These are also called Medigap plans. I know all this terminology can get confusing. So Medigap plans are supplemental plans that you would purchase in addition to having original Medicare. And it serves as sort of a wraparound to help you cover the costs that you pay out of pocket for Medicare. So it will help you for things like co-pays and your co-insurance and your and that kind of thing. And so Medicare supplemental plans are another thing to consider if you have original Medicare. Just kind of think of original Medicare as sort of this a la carte way of getting things. Medicare Advantage is your alternative to original Medicare. If you want to kind of go with this all-in-one plan, it's run by private insurance companies, but they're required to include parts A and B. Most Medicare Advantage plans will cover prescription drug coverage. And then, like I mentioned earlier, sometimes some even cover some extras. Your vision, dental, hearing, gym membership. Sometimes I said things like nutrition counseling, transportation. So you really kind of have to do your work and shop around if that's one way that you want to get your Medicare. It's also known as Part C, even though it's not quite sort of a subpart of original Medicare. It's sort of an alternative. And it is offered by private insurance companies, and it includes all those sort of services all under one plan. So that's the very sort of basics, is sort of helping people, if not yourself, and helping your employees, or helping employees help their loved ones. Many employees may have people who are Medicare eligible, and they're the ones who are caregiving and who are trying to navigate Medicare for their loved ones. And it, again, can get very confusing very easily. But I think one thing to really take away from this session is that there's sort of this one initial decision that you have to make when initially signing up for Medicare, and that is which pathway you're going to go. Are you going to get Medicare through original Medicare, or are you going to go with the Medicare Advantage plan? Once you decide that, I think you kind of branch off into other sorts of ways to shop around and make other decisions. If you go with original Medicare, for example, you'll shop around for a Part D plan, and you may shop around for things like a Medigap plan or a supplemental plan. So that's sort of one key takeaway, is that there's sort of two main alternative pathways to getting Medicare coverage. And when you're initially enrolling for the first time, that's the first decision you have to make, is sort of which way you're going to go. Next slide. So I talked about original Medicare. It's sort of A, B, and D, a la carte. It's a fee-for-service way of getting Medicare. It includes parts A and B. You can go to any provider that accepts Medicare. So you may not be limited like you would with Medicare Advantage plans, where you're just limited to that private insurance companies' network of providers. Most providers in general do accept Medicare. You would have to make sure that you call. What we find, though, is that sometimes not all doctors' offices necessarily are accepting new patients. So it may not be that they don't accept original Medicare. It may not be that it could be that they just don't accept new patients. But in general, you'll have sort of more choice and selection in providers by going with original Medicare. In general, Medicare pays about 80% of your covered medical costs. It won't cover all of it, so you do have that cost sharing. And as I mentioned, if you'd like to purchase a Medigap policy, if you have original Medicare, you can do that, and that can help pay for some of those out-of-pocket costs. Another thing I pointed out is if you have original Medicare and you want to get Medicare prescription drug coverage, you must choose and join a Medicare Part D prescription drug plan. Next slide. So when do employees sign up for Medicare? This is probably the section to really pay attention to when it comes to employees who are working, employees who are approaching retirement. In general, Medicare eligible employees are going to have an initial enrollment period around the age of 65, and it depends on whether or not they are going to continue working, or whether or not they are going to, let's say, retire or switch jobs or leave work. Different enrollment periods would apply to them. So the first thing to think about is the initial enrollment period, which is usually the 7-month window around the age of 65 that employees need to be aware of. For those who decide to continue working past the age of 65 and they choose to delay their Medicare enrollment, they will then have a special enrollment period when they do leave the company. And that special enrollment period is something we'll talk about, and that's an 8-month period that's separate from initial enrollment. And then every year there's an open enrollment period. The key thing to note about open enrollment for Medicare is that that's only for people who already have Medicare. It's not for those who are signing up for the first time. The initial enrollment period, the special enrollment, those are the periods for people who are signing up for the first time. Open enrollment, which is happening right now, it's from October 15th through December 7th. That's the time where people who already have Medicare can make changes. Next slide. So let's dig a little bit deeper into initial enrollment. And this is the opportunity where I think employers, business owners can provide maybe the most help in terms of helping employees make a decision about initial enrollment, or reminding employees about decisions they need to make around initial enrollment. So if employees are receiving their Social Security already, let's say they started collecting at age 62, they're actually already automatically enrolled at age 65. Employees otherwise do have 7 months to enroll. It's the 3 months before the month they turn 65. It's the month they turn 65, and then the 3 months after they turn 65. That is, in general, everyone's 7-month initial enrollment period happens during that time. Late enrollment means you will pay higher Part B and Part D premiums if you don't enroll and you had to enroll and you missed it. Let's go to the next slide. The next enrollment period is the special enrollment period. And these are people who did not enroll in the initial enrollment when they were first eligible, but that they were sort of allowed to delay enrollment because they had other coverage, for example, through a job or through an employer. This period is available to those who are over age 65, who are currently working and covered by their employer health coverage. Employees will lose their employer coverage either at the end of employment or at the end of their coverage. And so this is a 8-month window for those who chose to delay Medicare. There's actually no penalty if you choose to delay Medicare and you had employer-based coverage because you're continuing to work. That's the key. You have to be actively working in order to be eligible for this sort of special enrollment period that would not incur any penalties for you. So if you do not enroll in initial enrollment for an exempt reason, such as actively working, you'll be able to enroll in Medicare during special enrollment. Employees who lose employer-based coverage, for example, if they're going to retire or if they're going to switch jobs, you have 8 months from losing coverage to enroll in Medicare without a penalty. After that 8 months, these employees may face a penalty. So if you have employees who are retiring and who are, planning their retirement and trying to figure out healthcare coverage, that 8-month period, if they're over the age of 65, is really critical. You want to encourage them to make sure they enroll in Medicare when they have that window so that they can A, avoid gaps in coverage, and B, avoid penalties. Next slide. As I mentioned, open enrollment, not really a time period for people who are signing up for the first time unless your birthday happens to fall in that window. It's something that we raise now because you may have employees who are already, or yourself, you may already be enrolled in Medicare and you are curious to know what to do during open enrollment. This is the time period from October 15th to December 7th. You might be bombarded with Medicare ads or telemarketing calls or things like that. And that's because, there's a lot of sort of private insurance companies who are wanting you to purchase their supplemental plan or their prescription drug plan or their Medicare Advantage plan. And so it's not surprising that it can be confusing and sometimes misleading. Some of these ads will say things like, oh, you can get more money in your paycheck, or you can reduce your costs, or this is going to be free. And so it's kind of hard to distinguish what is real and what's not. Sometimes all of those offers may not necessarily be applicable to your situation. But anyways, open enrollment is the time for when people who already have Medicare can make those changes to their plans. So it's the time where people can switch from Medicare Advantage to Original Medicare, or vice versa. You can switch from Original Medicare to Medicare Advantage. Or if you can switch Part D plans or join a Part D plan for the first time, you can also switch Medicare Advantage plans. So if you went with one company one year and you want to switch to a different Medicare Advantage plan, then you do that during open enrollment. So every time you sort of make a Medicare coverage decision, think about it being, you have 1 year with it. If it's not like you're stuck with something forever, you do have this open enrollment period where you can switch things up. We know that your health may change from year to year, especially as we get older, and health plans change from year to year, they change coverage. So it's really important that during open enrollment, everyone reevaluates and reassesses their own health and what needs are that you can forecast for the year, Perhaps you have new drugs. Perhaps your drugs changed. Perhaps the health plan that you purchased a drug plan from, they changed their formulary. The formulary is the list of covered drugs. It's important to keep an eye on that, because if that changes, you may end up sort of spending more. So open enrollment, be proactive. It's the time to sort of reassess, just like you did with sort of health insurance through employer. There's normally an open enrollment period where you can make changes. This is the same thing for Medicare. But again, it's only for people who already have Medicare. Next slide. So I talked about the things that we really want to prevent, and penalties are one of it. We want to avoid gaps in coverage for yourself, for anyone, or for anyone's loved ones, but we also want to avoid penalties. And these are penalties if people do not sign up for Medicare when they could have and they didn't. And just keep note, for Part A, it's a 10% increase for monthly premiums for twice the number of years that you didn't sign up and you could have. Part B is 10% increase for monthly premiums for every 12-month period that you did not sign up and you should have. And note that this is a lifelong penalty. This penalty for Part B, if you don't sign up, will stick with you as long as you have Part B coverage. So you're not only are you paying more, but you're going to be paying more for however long you have Medicare Part B. For Part D, it's 1% of the sort of national average monthly premium cost for a Part D plan. In 2021, the national average was $33.06. 1% of that times the number of months that you could have had medical drug coverage and you didn't. And again, that's just like Part B, that will stay with you sort of lifelong, indefinitely, for as long as you have Medicare Part D drug coverage. So these penalties are something that we want to keep in mind for yourself, for your loved ones, for your employees and their loved ones. We want to make sure that they are aware of, if you don't sign up at the right deadlines, then you can incur these penalties. Next slide. So Medicare and your business. Diving in a little bit deeper into some of the nuances between the rules with when people should sign up for Medicare and when not to. Again, we want to avoid those penalties, but not every situation will necessarily incur those penalties. And so we'll go through that a little bit deeper. Next slide. Employer size is a major factor. It depends how big your business is. Employer size determines those Medicare requirements. In general, and you may have some exceptions, or you may need to, speak with CMS, or maybe you have a vendor who's more aware of the sort of regulations. But in general, if you're a company with fewer than 20 employees, eligible employees must enroll in Medicare when it's their initial enrollment period. So if they are deciding to stay working past the age of 65, it's important that they sign up for Medicare if they are in a company with 20 employees or less. Medicare will become the primary insurance, and any work-based coverage will become secondary. The work-based coverage will not pay if they did not enroll in Medicare. The work-based coverage for small companies with 20 or less employees only pays if Medicare pays, when Medicare pays first. So it really truly is a gap if they do not enroll in Medicare when they should have. For more than 20 employees, that they have a rule where you can choose to enroll in Medicare if you would like, or you can stay on work-based coverage. You don't have to enroll in Medicare for the first time for these larger companies. Those companies in general are required to offer the same health coverage that you to people who are 65 and older as any age employee in their business. And so large employers with 20 employees or more, the employee does not necessarily have to sign up for Medicare when they are first eligible at age 65 and if they continue to work. Medicare in this case becomes a secondary insurance. The work-based coverage, the employer-based health insurance will stay primary. Next slide. So the common scenarios for going back to a small employer with less than 20, the scenario really to go with is that they have to enroll in Medicare Parts A and B during the initial enrollment period. And Medicare has to become primary coverage, and then your job-based coverage, whether you continue to offer it or not, I think then becomes secondary, and it's that employee's, I think, choice whether they want that secondary coverage or not. But they do have to get Medicare when they first have their initial enrollment period. Remember, the initial enrollment period is a 7-month window that's centered around the month of their 65th birthday. They have 3 months before the month of their 65th birthday. They have the month of their 65th birthday, and then 3 months after. In general, in order to avoid any gaps in coverage and to sort of have no issues with penalties, it's better to sign up towards the beginning of that initial enrollment period, the 3 months before their 65th birthday. For large employers, there's again a little bit more choice. If an employee works for a large employer with more than 20, they can go ahead and enroll in Medicare during initial enrollment. They can enroll in Part A only during initial enrollment, but then delay Part B. And this is assuming the employee is still going to be covered by the employer plan and is still actively working until they decide to sort of retire or leave their work, in which case the special enrollment period for them, which is that 8-month window, would then kick into place. The third scenario is that they delay Medicare altogether. They delay Parts A and B until their special enrollment, and they continue on with the job-based insurance as their primary. So there's, this other scenario, in scenario 2, you have, they're enrolled in Part A, but they delayed Part B. But regardless, in all 3 of these, the large employer, you can have the job-based insurance be primary. They may decide, they have the option to choose, I want Medicare to be my primary. That's something that they can choose to do. But in general, people who work in larger companies will choose to keep their job-based plan as primary, and then the secondary is going to be Medicare if they decide to enroll in it, but you don't necessarily have to enroll in Medicare as a secondary. You can delay that. The reason why some people will enroll in Part A, regardless of whether they're working or not, is because Part A, as I mentioned, if you qualify, is premium free. So it's just essentially extra coverage that you're getting for free that you already paid into through things like payroll taxes, if you or your spouse worked for those 40 quarters in order to kind of get those credits towards getting the premium free Part A. So again, I know this is really overwhelming, but I'm hoping that we're trying to break it down a little bit further for you. Next slide, sorry. Initial enrollment education timeline. So as you know, there's things that we want people to avoid, gaps in coverage and penalties in general. And one thing that we ask, which we hopefully think is not a huge lift for employers, for business owners, is to help remind employees of that timeline. And again, I think one of the most important timelines to think about is initial enrollment. It's centered around the 65th birthday of your employee. So we recommend, 6 months before. Would you be willing to send out just a letter that just sort of says, hey, heads up, this year you're turning 65 in 6 months. Some things that you may want to consider is the decisions that you have to make around Medicare initial enrollment. Here's some information. If you have anything specific about your company, include that there. Or if you want to start providing links, go for it to different resources. That would be good, just to kind of get them to start thinking about it. At 3 months before the month of their 65th birthday, that's when their initial enrollment period ends. And I mentioned that's generally the best time for them to sign up for Medicare if they work for a small employer that's less than 20 and they have to sign up. That's the best time to do it. Or if they are deciding to have Medicare as secondary coverage because they work for a large employer and they want to sign up, again, do it, get it out of the way. Initial enrollment is going to be that 7-month window. So around that time, we encourage you to send maybe something a little bit more educational and informational. AARP has a number of educational resources around initial enrollment to really help guide people. And I'll point you to some of those resources today. So something to think about doing around that 3 months before the month your employee turns 65. So if you have some sort of database where you know their birthdays, like that's something that you might want to kind of put on your calendar to kind of make note of, and maybe allow that sort of trigger to help you provide and distribute materials. Other things that you can provide are third-party resource lists. Again, sometimes it's sort of hard to distinguish which of the companies are sort of just advertising and are insurance companies that may not be completely unbiased versus the ones that are more credible, trustworthy. So we can help provide those kinds of lists for you that you would simply just distribute or forward along to these employees during this time period. And then maybe right before the initial enrollment period ends for that individual, could you send a final communication that has all the materials, that summarizes the things that they need to do? Just one final reminder. These are things that are so helpful to people. You most likely did things like this during your regular open enrollment period, during with health insurance, with your job-based health insurance benefits and other benefits. And so can you start sort of thinking about including Medicare in this mix, which will likely have a different timeline for every single employee, but that little bit may help them, again, avoid those sort of lifelong penalties that they could get, or avoid those gaps in coverage. You know, healthcare is sort of the #1 financial cost for people, and we want to make sure that they have adequate coverage. Next slide. So we want you to engage your employees on Medicare, providing them with clear, consistent communication, refer employees to trusted and reputable sources, and educate employees about Medicare prior to eligibility. It takes a lot to really get a grasp on all these different complexities of Medicare. And so maybe a one-off workshop could be helpful, but it's always great to supplement and to communicate early and often, not just to those who are approaching 65 or who you think are approaching retirement, but to all your employees. As I mentioned, there may be a number of people who are caregiving, who have older loved ones, and who are trying to navigate for their families. And so it's important to kind of be able to provide that information, most of it free, and without you hopefully not needing to do too much of a lift. So we'll go quickly through some resources next. We covered a lot, but I'm sure you'll have additional questions after the fact, and I want you to make sure that you know where to go to. So for assistance, of course, there's Medicare.gov. Medicare.gov is run by the Centers of Medicare for Medicare and Medicaid Services. Medicare.gov is the official US government website on Medicare information. And they have actually issued a number of tools that I have found very helpful. They have a phone number. In general, lately, the phone number has been reserved for emergencies, mainly because of the pandemic, but there is that phone number there. It's 800-633-4227. But Medicare.gov is the website, and they have tons of information. There is a tool on the website called the Plan Finder. So for people who are shopping around for the first time for Medicare Advantage plans or for Part D plans, the Medicare Plan Finder is great. You can select up to 3 different plans and compare side by side things like the deductible, the copay, the coverage. And that's very, very helpful when you're shopping around, whether that be during initial enrollment or during open enrollment when you're trying to make changes. Another new tool that they just came up with is sort of a healthcare compare tools. I think it's called Medicare.gov Care Compare, where you can compare side by side different healthcare providers, different facilities, hospitals, that kind of thing. So really great tools on Medicare.gov. Next slide. Sometimes people just need one-on-one assistance, and you want to talk to someone because talking about your situation can be very complex and kind of hard to sift through in a tool or to email. And so we think these two organizations are great resources. They're trustworthy, unbiased, credible sources of Medicare education and information. I'm going to point to the State Health Insurance Assistance Program first. Those are called SHIPs. They're all about helping you navigate Medicare, and they're state-based. And so what you would do is go on this website or call the number and find the state-based organization phone number in your area, and you would call them and you can ask them about your Medicare questions, and they will provide that one-on-one unbiased counseling on Medicare. Very, very helpful. Medicare Rights Center is equally as great. Medicare Rights Center is a nonprofit organization that has wonderful education and information about Medicare. You can call their number here as well, and their website. Next slide. Last but not least, AARP, as I mentioned, we're here for you, whether you're a member or not. We have educational information about Medicare, and we have some great tools on our website, aarp.org/Medicare. And again, another way where you can sort of shop around, learn the basics of Medicare, and learn sort of questions to think about, questions to consider, variables to think about when you're enrolling in Medicare for the first time or when you're shopping around for different plans during open enrollment. In addition to our website, I want to point you to our webinars. We have a number of webinars on Medicare. Next slide. And that's available at aarp.org/Medicare employer. In fact, just this week, actually just last night, we had a webinar specifically on Medicare and those who are continuing to work past the age of 65. And you'll see me on it again, but it was a very great webinar and it's on demand. It was recorded and on demand. So if you go to aarp.org/Medicare employer, that is a wonderful thing to send to your staff. And they can learn not just about the upcoming webinars that are live, where they can actually ask live questions, but we have on-demand sessions, like I mentioned. The one that we just recorded yesterday on November 16th was all about sort of working and having Medicare, what to do as you're approaching Medicare eligibility, and or if you're retiring and you have job-based insurance, what to do. We answer a lot of questions. So this is a wonderful website to make note of and just keep an eye on, because we're constantly updating and adding new events. Next slide. In conclusion, thank you. I know I just dumped a lot of information and that was just the basics. And so we can get, again, real complex real quick. Just know that you're not alone if you're confused about Medicare. I know so many people are. It's taken me quite some time to really get a handle on understanding it, and things always change. And so it's really important to stay educated yourself if it's your own situation you're thinking about with Medicare coverage, but help your staff. Help your employees. This is a huge decision that's really important, that has long-term consequences and impacts. And so it's really important. And we think hopefully it's not too much of a lift to, if anything, point people to the resources that we brought them to, let them get that sort of one-on-one counseling through their SHIPs, or, you know, hand out a flyer that has links to some really important information to help them out. So I think we have Colin, maybe about 10 minutes for questions. And I know before we went to questions, I did want to kind of get a pulse check and see what you all thought. So we have a quick poll. If you don't mind answering them, it should pop up on your screen if it has not yet already. And we want to know questions like, you know, did you find the information presented today valuable and useful? Are you going to use this information? Do you plan on sharing this information to your employees? Medicare education, I don't think is something that employers traditionally think of as a high priority. And we want to provide more awareness that it is important and that there are impacts, and that, you know, many people are struggling making this decision by themselves, and sometimes are not even aware of the things that they need to do themselves. And so if you're you took the first step by joining this session today. If you have more questions, if there's an appetite for more things like this that we can provide business owners like yourself, your staff, other employers and companies, let us know. We kind of want to hear that feedback. Welcome to drop it in the chat if you have some open-ended feedback, and we may possibly sort of follow up on a survey as well. But we hope that we're helping you make it easy to provide that education and information to your staff. We hope that you learned yourself something about Medicare. If you are trying to navigate this decision right now in terms of enrolling or in terms of making choices about your Medicare, if you already have it. So, open to your feedback, and we will be providing the recording, and you're welcome to, again, submit questions, and thank you for the feedback in the poll. So we do have a few minutes. Let's see.
We're getting some questions in the chat and in the Q&A button, and I know we're kind of finishing up this last poll question. So we thank everybody who has had a chance to respond, and just for the engagement today. I think it's been so fascinating, Tricia, and just hearing you talk a little bit more in depth about Medicare. And so, one of the questions that we have kind of lined up and ready to go, and we're interested is, can you tell us a little bit again about what happens to an employee if they miss a deadline, and why some of these things are so important to make sure that employees actually get signed up at the right time?
Right. So, I don't want to just, instill fear in people. I think the biggest thing to be concerned about is that if you miss a deadline, you could get a gap in your healthcare coverage. And, you always want to sort of have that ongoing continuous coverage when it comes to healthcare, because you never know what could happen. Your health could change at any time, or, you might have an issue. And so gaps in coverage are what we want to avoid, and we want to avoid penalties. If you don't enroll in parts B and Part D in particular, those are penalties that will stick with you for lifelong, for indefinitely, however long you have Medicare coverage, and it's avoidable. And so I think this is what we really want to educate around, is that you want to avoid the, for Part B, it's a 10% increase for every year that you didn't have Medicare that you could have. That sticks with you. That's tacked on to your monthly premium lifelong. And then Part D, I know can get really confusing, but that's that 1% of the national average monthly premium for Part D costs times the number of months, not years, times the number of months that you didn't have Part D coverage and you could have. So there are those penalties. We want to have you avoid them. We want to have your employees avoid them. And I think it's just all about being aware of your initial enrollment deadlines.
Yeah, and we're getting some questions in the chat and Q&A box about where to find more information, because I know some people have a lot of different situations, whether or not they have different types of coverage, and there's a lot of information out there about Medicare. And so where are you sending people for unbiased information? Where can they find out more about, Medicare gap insurance and long-term care? Where are the places that they got to go?
Sure. I mean, Medicare.gov is going to have great information on their website. If you want that one-on-one counseling, I refer people left and right to SHIPS. It's the state health insurance programs, and they have one in your state. You would call their 1-800 number. You can go on shiphelp.org to get that information, to find the state-based number, and they're great. Again, that one-on-one counseling by phone if you actually want to talk to a person. Medicare.gov is going to have some great overall information about, things like you said, Medigap plans or long-term care. And AARP.org/Medicare will also have very similar information. We're really trying to not make it so confusing and trying to help you navigate it. It is very easily confusing, and we want to kind of break it down in sort of these digestible chunks, depending on sort of where you are in your Medicare journey.
It's helpful. And we have a question here about, if they have an employee that retired early at like 62 and a half, will they automatically be signed up for Medicare, or will they need to go sign up for it?
In general, yes, that person should have automatically been enrolled by the Social Security Administration. I always encourage them to follow up and call. I mean, in general, yes, it should be an automatic enrollment if you collect Social Security before the age of 65, but it's always good to have that in writing. It's always good to have that confirmation. It's very likely that person may have already received a letter from the Social Security Administration, or they may have received something like their Welcome to Medicare package that's going to have things like a Medicare and You handbook that describes all about parts A and B and original Medicare. But I would always encourage them to follow up and just make sure, so that you can avoid that and always have things documented.
Great. And I know we're right on time, so I think we have, one more question, which is, beyond sharing resources, what is the role that small businesses and employers can play to help educate themselves and their employees on Medicare?
If you're willing to kind of take that larger role, I think planning a Q&A session, I'd be open to speaking with anyone if they're interested in a more in offering a session like this for their employees. This session was mainly for employers, but if you want a version that we do for your employees, we'd be happy to offer things like that. So, one low lift is that forwarding an email that has links about Medicare, or forwarding the links to our Medicare webinars. I think that's a really good step, and that's plenty. But I think if you want to be a little bit more hands-on, think about that timeline that we proposed, where it's like, you would provide so much help if you offer these reminders to people as they're approaching initial enrollment, and they, especially if they have to enroll in Medicare as their primary insurance, particularly those businesses that have 20 or less employees. I think it's very helpful for you to be more hands-on when it comes to that timeline, those triggers, those reminders to send to those folks, because they may not know, they may not be aware. And I think it would be really great if you would be willing to distribute that information and send those emails, set up something automatic if you can, that based on that person's birthday, where you can send reminders like that. Again, the 3 months before the month they turn 65 is a really good time, because it's critical. That's the beginning of their initial enrollment period, and that's really the best sweet spot time to enroll in Medicare when you're signing up for the first time. I do have my contact information, so if you want to take me up on an offer for follow-up on more educational sessions like this, send me an email. I'm at tsandiego@aarp.org. You'll look at our websites, aarp.org/learnmedicare. As I mentioned, I also do a lot of caregiving education with employers and with employees, people who are working caregivers, who are balancing that. We have caregiving resources specifically for small businesses, and that's available at smallbusinesscaregivingguide.org. Knowing that there is these intersections between Medicare and caregiving, I think the two topics really do overlap. But all in all, I just want to say thank you. Thanks to everyone for your time, for sticking on for this long. I know it's a lot of information. This is recorded. You'll be able to reference it back. If you want some more information after the fact, shoot us an email, and we have things like resource flyers. We have web links that we would be able to send to you. So thanks again, and I hope everyone enjoys a great holiday next week.
Thank you, Trisha. I just think this has been so rich and so much information. I'm sure everybody's going to have to watch it a few times to make sure they got everything, but I think it's in service in helping those employees kind of navigate this really important transition. So we'll be following up with everyone via email and sending the recording, but we hope everyone has a great holiday. And now this is the official end to the webinar. Thank you.
Thank you so much.